Good morning, everyone. We are going to talk today about hyperthyroidism. In the following video, we are going to discuss what do you mean by hyperthyroidism. Then we'll look into the causes of hyperthyroidism. After the causes, we'll study the clinical features, signs, and finally, we'll study the investigations and the management part of the hyperthyroidism. So, starting with what do you mean by hyperthyroidism? It means increase in the function of thyroid gland, whereas thyrotoxicosis means increase in the level of T4. Remember this difference. Now, what are the causes of hyperthyroidism? Why the function is getting increased? It can be primary causes and secondary causes. In primary causes, the most common cause is the Graves' disease. In Graves' disease, we have thyroid stimulating antibodies which mimic TSH and causing T3 T4 level to be raised. Whereas secondary causes can be like pituitary adenoma, which cause excessive TSH synthesis. So to differentiate between primary and secondary hyperthyroidism, we use TSH value. TSH value is decreased in primary, and whereas the TSH is increased in secondary. There can be some other causes also like thyrotoxicosis, cachexia, where we consume the thyroid gland of any animal, or it can be toxic multinodal goiter or stroma ovary can also cause hyperthyroidism. But these causes like gestational trophoblastic neoplasia, where HCG mimics the TSH, these causes are a little rare. Now coming to the clinical features. In clinical features, the main point is there is increased sympathomimetic activity. So you will find all the features related to it. Along with it, you will find the patient to be hyper reactive, irritable. In the sympathomimetic features, you will find increased in the heart rate. There will be a sinus tachycardia. There can be risk of arrhythmias, atrial fibrillation. You will find fine tremors, sweaty palms, and soles in the patient. The basic metabolic rate will be increased, resulting in weight loss. There will be a heat intolerance in the patient, and if it's a female, she will present with oligomenorrhea, infertility, and in Graves' disease, there are some typical ophthalmic features also. So the ophthalmic features will be like late retraction. Later on, it can involve the inferior rectus muscle causing diplopia. Proptosis can be there. There can be soft tissue involvement causing periorbital edema. In the late stages, it can involve the cornea causing exposure keratitis, and even optic nerve can be involved in causing retrobulbar neuritis. So these are all the ophthalmic features of the Graves' disease. On examination, you will find loud S1 sound, ejection systolic murmur can be found. You will also find pretibial mixed edema, and even on sleeping, the pulse rate will be higher, the most reliable sign of thyrotoxicosis. Coming to the investigation, as mentioned earlier, thyroid function test you can do. Even thyroid scan can be done, and in thyroid scan, you will find increased uptake of the radioactive iodine, which we use. It's radioactive iodine 123. You can also go for USG and MRI of the neck to rule out the secondary causes. Now, coming to the treatment. Treatment is for Graves' disease, we give radioactive iodine ablation. Radioactive iodine 131 is used. Some antithyroid drugs like propylthiouracil and methimazole can be also used. PTU is safe in the first trimester, whereas methimazole is safer in the later trimester. And even surgical treatments like total thyroidectomy can be done if there is a poor response to the medical treatment. And for secondary hyperthyroidism, we do a transsphenoidal surgery. So this was all about hyperthyroidism. I hope you liked the video. Thank you for watching.